Hi, it's Mary from the Movement Studio, and I'm here today to tell you about a really common pattern I see with low back pain. So here's what I see a lot with a lot of my clients is they tend to be in what we call an anterior tilt in the pelvis. So the pelvic bone goes forward, and when that happens, and you've heard me maybe in a blog talk about the term perching. They're sort of perched on their chair. But this can also happen in standing. But when that happens, the abdominal muscles get too long. So these muscles here that attach to the rib cage and the pelvis get too long. And then the hamstrings, and this is where it gets interesting, the hamstrings are what we call inefficient. So these two muscle groups, the abdominals coming down from here and the hamstrings attaching here to the pelvis, need to be in the right ability to contract and the right length relationship to help stabilize the pelvis. So these two muscle groups are really important how they work together. And what I see a lot is, especially in the yoga community, is that these muscles on some people are actually too long. Now on some people they're not too long, but they're just inefficient. They're not facilitated or strong enough in a certain way. But some people are overstretching their hamstrings, which are causing more of this problem of tilting forward. So in bringing this to a close, this is one possibility that gets overlooked quite frequently with a lot of my clients, is this imbalance in these two muscles. Now granted, we could have a lot of causes of low back pain. In this position, it could cause a pinched nerve, or you could have a disc problem in your back, so there's lots of things to consider. But this simple way of just shortening these abdominals and getting these hamstrings in right relationship can help diminish a lot of low back discomfort. And if you feel like this might be a pattern that you're in, feel free to give me a call and we can set up a free discovery session, a free 30-minute session. You can come in and I can assess you and see if you possibly are in this pattern.